Welcome back to the Fit Rev Health Corner, where we help you get fit and stay healthy. So let's take a look at the coronavirus disease that has been having the world under severe lockdown, has now declared a world health pandemic. The reality about it is that a lot of people, they are scared at the moment, and we all should be scared. We don't know what it is that we're up against, what we're dealing with. There's nothing in place to help those who would contract it. But let us not be scared at this moment. I think more so we need to be practicing good and healthy hygiene. And hygiene meaning you're gonna keep your hands clean, okay? Practice social distancing, and stay in home if you don't have to be outside. Keep your family safe, keep them protected. Let's take a look on into this virus, what we're dealing with. All right, so what causes this world pandemic here? It's a crucial time in our life, and at this moment we're going to look at a few things as it relates to the coronavirus, which will give you more insight and understanding, so as to alleviate some of your panicking, more of education and understanding. And once you know what you're dealing with and how to, then you'll be better able to handle instead of panicking. Okay, so in a nutshell, we're looking at the coronavirus. We understand that a cluster of pneumonia cases outbreak in Wuhan, China, late last year, all right, which is now, based on after the investigation and looking at it, it is now classified as the 2019 novel coronavirus. What is known about this virus? The COVID-19, as it is right now, whatever information I share with you, it is likely to be changed at a later date, which I also will give that update, because it is something new and involving, and as scientists work to get a more understanding of this virus, the data will be changing as well. So we have to bear in mind that the coronaviruses, right? They are a large group of viruses that consist of genetic material surrounded by an envelope with protein spikes, which gives it the appearance of a crown. Crowns in Latin means corona, and that is why these group of viruses have been classified as coronavirus, right? We're going to look at a few types of coronaviruses, and the different type of coronaviruses that cause respiratory and gastrointestinal disease. We look at respiratory disease as things like the common cold, pneumonia, which are generally mild diseases and can be dealt with once they are detected at an early stage, of course. However, there are some kind of coronaviruses that can cause severe disease, and these include SARS, which was from China as well, in 2003. And we see that as a severe acute respiratory syndrome, and related coronavirus is a species of coronavirus that infects humans and some animals. All right, and this SARS, it is understanding that it came from camels. All right, and we see the next one, which is called MERS, which is MERS, COVID, which was in Saudi Arabia, and that was in 2012, right? The Middle East respiratory syndrome, right? It is also related to animals, and humans can contract it. This one was caught from cats, right? And now we're dealing with this 2019 novel coronavirus, which is also from China. It is unknown at the moment because, as I said earlier, that they are developing, they are researching, they are working hard to find out exactly what we're up against. And by knowing what we're up against, then we can make better decisions to control it, right? So COVID-19 initially occurred in a group of people with pneumonia disease who have been consuming food, and that is seafood, and from the live animal market in Wuhan. The disease has since been spread from sick people to others, such as family members and healthcare workers. And we can understand what is happening there because when individuals are sick, they're going to come in contact with their family members, and they're going to come in contact with healthcare workers and friends. And that is why we want to practice social distance, and especially if you're feeling sick, okay? So here, and currently, there are over 260,000 cases throughout the world, affecting 183 countries, areas, and territories. Alright, so this thing is all over the place. We're going to take a little look on the origin of this virus. It is unknown, right? It is unknown in specific details, but we're going to read the information that we receive, and all of this information is from the World Health Organization, okay? It is known that the virus circulates in a range of animals, which sometimes can make the jump from animals to humans. This is called a spillover, and this can happen from a range of factors such as mutation of the virus, okay, and increased contact with animals. So while we cannot prevent the mutation of the virus, right, we can monitor our contact with animals. That means that it's a likely possibility that if you are a pet owner, you might have to get your pet checked as well, okay? How is this virus transmitted? The exact dynamics of how the virus is transmitted is not yet determined. In general, respiratory viruses are normally transmitted through droplets, and these droplets occurs when an individual sneeze or cough, right? Most of the time these droplets, they don't stay in the air, they fall. So if you're between 2 meters between individuals and that should occur, it's highly likely that you won't be affected. But the surface that is between, the area that is between you and that individual will likely be infected, right? And because it's now infected, you can also get that virus from the surface. Instead of the individual directly, you can now pick this up from the surface. And based off my understanding with the coronavirus, first they had indicated that it can live up to 12 hours, and at the next point it was indicated that it can live up to 3 days. So your hygiene at this time, your hygiene practice is very critical, because that is going to be the determining factor between you surviving this pandemic or you going down with the pandemic. You have to practice good hygiene. It's no longer a nasty way of life, and it's okay to do whatever. You have to keep yourself clean, your surrounding clean, and everyone around you clean. We move on. We're going to look at the group of people, or the group that is mostly at risk. And now we see that people most at risk to contract this coronavirus are those who are in close contact with animals, and also in the live animal market, right? And those who are taking care of infected persons, and also family members, and let me not leave out friends, okay? At this point, we're going to look at some symptoms. From what is known so far, there are a range of symptoms that they have identified with the coronavirus, and these are fever and dry cough and shortness of breath. So if you have mild common flu or cold symptoms, they say those you can deal with at home. But if you have high fever that's not reducing, and if you have a dry cough that is continuous and is not going away, and if you're experiencing shortness of breath, you need to contact a healthcare provider or call the relevant numbers that are out there for your various countries, cities, and communities. Use those healthcare lines and make the call, and then take directive from there. And don't wait until you're dying to make the call. Make the call early. There are also platforms where you can go online and do a self-assessment to see what state you are. Okay, so moving on. We also look at some severe symptoms, which are pneumonia, kidney failure, and death. Now, you would have already been at a healthcare provider for them to see all of those, right? So, again, we don't want to go to the severe cases. So, if you are feeling ill any at all, make a call, do a self-assessment so you can make the next step. People, this is not time to take this thing lightly or take it for granted. It's a serious time for us to be very careful. Listen, right now, you are playing a critical role in your life. There's no time for you to play around with what's happening. Drop the friend thing, drop this whole family thing. Stay in your house. Talk to your friends, FaceTime, message. Talk to your family member, FaceTime, messaging. You have to protect yourself because this virus, it is living in, people are carrying it around without showing symptoms, and it's passing on to other people. So it is highly likely that within a couple of weeks more, we're gonna see crazy more cases than what we have seen already, right? So you are very important in this particular time of life. The mortality rate currently is not exact, but we are over 11,000 confirmed death. All right. We're gonna look at how to diagnose this coronavirus, and the only way right now they can find if you are infected with the coronavirus is that they use a machine called the PCR, or the polymerase chain reaction machine. That test is done to identify the virus based on genetic fingerprint. Okay? At this time, we're gonna look at treatment. There is currently no specific medication for the virus and supportive care, as well as no vaccine to protect against the virus. Treatment and vaccine are currently in development. So, as I said earlier, this is not something to joke about, because it's not like some things where you can catch and then you can go and get it deal with. We don't know how to deal with this, so you don't want to catch it. You don't want to find out. Okay? Now we're looking at prevention. And I started out with prevention. Throughout this presentation, I've been talking about prevention. But let's look in it a little more in detail. Alright, how can we prevent transmission of this virus? This is a new virus. Alright, it is currently limited to geographic spread. However, there are a number of standard hygiene measures that need to be practiced, need to be enforced by local authorities, need to be enforced by you and your household and your family. This is things that need to be enforced, okay, to help combat the spread of this virus. And some of these things are: one, covering mouth, all right, and nose when sneezing or coughing. And when you're covering your mouth and your nose, you can use medical mask. You can bend your elbow, okay. You can use sanitized paper, and please note that after you use those papers, you need to dispose of them properly, and you need to wash your hands with soap and running water. Avoid close contact with those who are sick. So even if somebody is sick in your house, you don't want to be in close contact with that person. You want to isolate that person. And what isolation is, you're going to keep that person in one place, right? And if you bring stuff to that person or etc., right? But you don't want to have that person moving around in the house, touching things that you are going to touch, using things that you are going to use, because that is going to become contaminated and you are going to become sick like the person. So I mean, so you don't have to have extra room or whole heap of rooms in your house to do this isolation. You just want to ensure that you're keeping this individual in one space by themselves, and also they need to always have on a medical mask or a facial mask to restrict the aerial movement of the virus to themselves. Okay, we're gonna look at also the appropriate use of mask and PPE. Now, depends on where you are, right? You need to wear your mask, depends on the environment that you're in. And we're looking at PPE as personal protective equipment. So whatever is needed for you to protect yourself in a particular environment, please ensure that you have those PPEs for your protection. Especially when we are in a health care setting. It is critical because people who are healthy and well, they don't go to healthcare providers, right? It's people who are sick normally go there. So it's highly likely that if people are sick there, then the area is also contaminated to some extent. So again, you want to take extra precaution when you're in healthcare settings. It's very important. Wash hands regularly with soap and use alcohol-based products to keep the hands clean. And you know that the alcohol strength need to be above, I think, 70%. So yes, for it to kill the germs or the virus. Action that can be taken at this time to prevent the spread of this virus from animals is to wash hands after contact with animals or animal products, and ensure that if you're eating animal meat that you cook it properly before you consume it. Very important. Alright, it is important for you to stay home if you are feeling unwell, or it is important for you to stay home overall. Seek medical care early. Don't wait until it's too late. If you have the following symptoms, please seek medical care. High fever, coughing, dry coughing that is prolonging, and if you're having difficulties breathing, please seek medical attention. Once you arrive at a medical facility to be checked, you must always provide your travel history to your healthcare worker. We will update you as soon as information is updated. We will keep you updated by this means. You can also visit fitrev.ca and go to our Health Corner section and read this article. If you have not grasped enough information from this video, you can also go through the article there, the blog there, and get full details. Stay safe, and you'll be updated via this. Thank you for joining us and the FitRev Health Corner.